Welcome to the training session on the proper use of personal protective equipment, PPE, in the medical field. PPE is crucial in protecting healthcare workers from exposure to infectious agents. This training will guide you through the step-by-step procedures for correctly donning, putting on, and doffing, taking off, PPE. PPE acts as a barrier to protect healthcare workers from exposure to infectious agents and hazardous materials, reducing the risk of disease spread and cross-contamination. It helps healthcare facilities adhere to health and safety regulations, ensuring safe practices during high-risk procedures and minimizing legal and health risks. By reducing the risk of healthcare-associated infections, PPE safeguards both patients and healthcare workers, contributing to overall improved safety and care quality. 1. Hand sanitizer or hand washing station. 2. Gown. 3. Surgical mask or N95 respirator. 4. Eye protection, goggles or face shield. 5. Gloves. 6. Biohazard disposal bin. Make sure all required PPE items are organized and accessible, and remove any jewelry. Also secure long hair before donning the equipment. Thoroughly wash your hands with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer before handling any PPE to minimize the risk of contamination during the donning process. Choose the appropriate size gown. Unfold it and slide your arms into the sleeves. Fasten the gown at the neck and waist, making sure it covers from the neck to the knees and wraps securely around the back. Now place the mask over your nose, mouth, and chin. Secure the ties or elastic bands at the middle of the head and neck. Mold the nosepiece to fit snugly. Now click on mask. Cup the respirator in your hand, allowing the straps to hang below. Place the respirator over your nose and mouth, securing the bottom strap at the base of your neck and the top strap around the crown of your head. Perform a fit check by inhaling and exhaling. There should be no air leaks. Put on safety goggles or a face shield to protect your eyes from splashes, sprays, or droplets. Now click on safety glass. Make sure you grab a glove by the cuff with your dominant hand, being careful not to touch the palm or fingers. Repeat the same for the other. Now click on gloves. Great work! Now you know how to properly wear the PPE. You should grasp the outside of one glove at the wrist without touching your skin. Peel the glove away from your hand, turning it inside out, and hold the removed glove in your gloved hand. Slide your fingers under the wrist of the remaining glove and peel it off over the first glove. Dispose of both gloves in the biohazard bin. Now click on highlighted bin. Pull the gown away from your neck and shoulders, touching the inside of the gown only. Turn the gown inside out and roll it into a bundle. Dispose of the gown in the biohazard bin. Clean your hands with hand sanitizer or wash with soap and water. Handle goggles or face shield by the headband or earpieces. Place eye protection in the designated receptacle for cleaning or disposal. For a surgical mask, untie the bottom tie first, then the top tie. Remove the mask without touching the front and dispose of it in the biohazard bin. For an N95 respirator, Thoroughly clean your hands with hand sanitizer or wash with soap and water. This has been an example of using PPE. Feel free to review the experience again or return to the homepage to try a different experience.